I'm Letty Mederos, and I am the Labor Director at the Help Committee for Senator Patty Murray. On behalf of the Senator, I say welcome to you all. Thanks for coming. This is usually where we meet to do hearings and sometimes talk about issues, so we're delighted to have you here. The work of the Work and Family Research Network could not be more important and needed here in the halls of Congress. It is here, as you know, where policy is made, laws are written, with untold reach into people's lives. And we know that policy is not sound, we've seen it many times, if it is not informed by solid research. Some years back, when I worked on the issue of the wage gap, I couldn't have prepared my boss to tackle the toughest skeptics without the research of the IWPR. And later, when we embarked to introduce legislation for paid sick days, we looked to the work of Jody Hyman to build the case, and IWPR and National Partnership and so many other partners that came along. So I just want to say thank you for what you do. Thank you for being here, for gathering in this city, not somewhere in the middle of the country. This is where the policymakers need to hear the latest research and the impact on people's lives, which is what it's ultimately about. So we need you. Please keep at it. We've made huge progress in work and family issues, but we have a long way to go. None of the bills that I personally have been involved with in the past 15 years are yet to become law. So we got to keep it up until they do, because we know how important they are. And of course, it's a silly election season. This year's sillier than ever. But you know, at the same time, the stakes couldn't be higher for issues like paid leave, short-term and long-term, for paid sick days, for equal pay for women, for pregnancy, anti-pregnancy discrimination, you name it, for the policy to catch up to the reality at work that men and women face. So I want to hand it off to Heidi, one of my personal heroes, and a true ally to Senator Murray, to Congresswoman Rosa DeLauro, former Congressman George Miller. Heidi was always a phone call away, and her wonderful staff too, to help us prepare for markups or floor statements to make the arguments. So I can't thank you enough. And Heidi will do the follow-up introductions.
Well, thank you so much. Right, sorry. Thank you so much, Leticia Mederos, whom we know as Letty. There's a famous German saying that it always helps to have a friend in government. And Letty is our friend, especially on Capitol Hill. When we need a room, when we need a voice for our ideas, when we need a hearing, she provides that for not just IWPR and the Work and Family Researchers Network, but for many of the other people in this room, all the different coalition groups and research organizations you work for. Senator Murray and Letty have been absolutely essential to us. So thank you. Thank you so much. It is my pleasure to be co-hosting this with the Work and Family Researchers Network, of which I am a founding member. Our founding president, Jerry Jacobs, is with me at the other end, and he'll be able to say a word about the Work and Family Researchers Network shortly. The Work and Family Researchers Network is having its national conference at the Capitol Hilton on 16th and L, I believe, for the next few days, Thursday, Friday, and Saturday. So if any of you are not registered for that and want to come hear lots more about work and family research, you are more than welcome. This panel of speakers are all members of the Work and Family Researchers Network. We've tried to bring together some cutting-edge research, unpublished and published recently, that will really tell you more about the two issues that have some momentum behind them, at least in part of the Senate and the House, and those would be a Universal Paid Sick Days Act at the federal level and a Universal Paid Family Medical Leave Act at the federal level. Exactly when they might happen, of course, is anyone's guess, but I do just want to say by a positive note to get us started that we now have 5 states that do have paid sick days required for virtually all their workers, some more generous than others. some defining all more generously than others, but plus the District of Columbia. And those states are largely in New England and on the West Coast. And paid family leave is a similar split. We have California, New Jersey, and Rhode Island, and most recently New York. So 4 states now will have universal paid family leave, and those happen to be 4 states that also have universal temporary disability insurance. For those who might not know what that is, that's a short-term disability, usually for not work-related, like a car accident, cancer, heart disease, pregnancy, and childbirth. So TDI, as well as family care leave, can protect pregnant women and women giving birth. So we are making progress across the United States. In fact, since 2012, the number of states with paid family leave has doubled, so there you go. And just a few years ago, there were no states with paid sick days, so there's now, I think, more than 25 jurisdictions when you count all the cities as well that have paid sick days. So we're making a tremendous amount of progress. I hope all of you are familiar with IWPR. Please check out our website because we have a ton of materials, and we also had some out on the table outside. So now I want to turn it over to our very distinguished panel. Our first speaker is going to be Christopher Ruhm. He is a professor of public policy and economics at the University of Virginia. He received his Ph.D. in economics from the University of California at Berkeley. He's taught at University of North Carolina, Greensboro, Boston University, and he also served as senior staff to President Clinton's Council of Economic Advisors. So he's very well known in both policy and research circles, and his main areas of expertise are health and labor, and that, of course, makes him a very good person to have brought into the community of scholars working on paid family leave. So, Chris, all yours.
Thank you very much. You know, there are many people I'd like to thank, Senator Murray, Heidi, but I've been told I have 8 minutes to assess paid leave, so I'm not going to go any further on that. So, you know, this is a very exciting time, I think. We may be on the cusp of some real change. We've seen a lot that's already happened at the state level, and maybe we're going to see something at the federal level. So I'm not sure if you can read this, but I just thought I'd give you a snapshot of where we are today. So as you all know, we have the Family and Medical Leave Act, which provides 12 weeks of unpaid leave to some new parents, and also for other reasons. These are family leave, not just parental leave. And then, as Heidi just mentioned, there are 4 states that currently have paid leave programs: California, New Jersey, Rhode Island, and starting in 2018, New York. You can see from the table up here, the duration usually is fairly short, 4 to 6 weeks, although the New York program, it will, with a phase-in period, go up to 12 weeks. The wage replacement rate varies again, usually somewhere between 55% and 2/3. California is in the process of raising their top rate. And then in San Francisco, there's a recent top-off policy where employers will essentially top people off to 100% wage replacement rate. I'm not going to spend more time on the details, although we can maybe, you know, at Q&A talk about some of them. But let me just very quickly summarize some of the effects first of the FMLA and other state unpaid leave policies. The bottom line here is these policies do make a difference. They increase leave taking. I'll note they increase leave taking of both mothers and fathers, and actually by fairly similar percentage amounts, although fathers take so much less leave that you're talking about days, whereas for mothers you're talking about weeks. We don't see much evidence of a change in future employment, some evidence possibly of benefits on infant birth weight. One of the things I want to note, though, is the gains that we see from the FMLA are primarily for relatively advantaged parents. And so by that I mean, for example, mothers in two adult households versus single households, highly educated mothers, and so forth. So unpaid leave seems to make a difference. It actually increases disparities within, say, if you look at within groups of mothers, it actually increases disparities. Now, that may be not a bad thing in the sense that you're helping one group, but the group you're helping tend to be relatively advantaged. So I want to then talk about state policies, in particular California, and I'm going to give you a a one snapshot slide. So for those of you who are not researchers, you can understand how most of this research works. So typically, we estimate what are called difference in differences models. And essentially what we're doing is looking at the difference in, for example, California before and after their leave policies are put in place, and then we're comparing it to some control states. So the idea is anything that's changing over time generally will be captured. So I don't know if you can see, but the top line, that purple line, is California after the policy is put in place, and the green line is California before. The other two lines are the other states before and after. And what you notice, there's essentially nothing going on in the other states before and after, and there's this gap that emerges in California. So that kind of shows you sort of just generally how we do it. So what are the bottom lines that we see from California? And the reason much of the research is California, they've had the program the longest in place, and also it's a big state, and so we can get enough data to at least say something. So again, as we see increases in leave taking, again, for both mothers and fathers. And I want to note Jenna, who's on the panel here, did a lot of work on a paper we've just done on fathers and showed that there's actually significant increases there. There's some evidence of mothers for increases in future employment and wages. Now, it's not terribly strong. Partly it's a data issue, but there do seem to be some benefits. And here, unlike for the FMLA, the benefits appear to be concentrated among less advantaged mothers. So this is actually reducing disparities. The best evidence we have for employers, there's a lot of concern about effects on employers. The best evidence we have so far is that it's sort of a non-event. Now, I want to say I don't think the evidence on employers is very good at this point. I think we need to learn more, but I'll just give you one slide. This is some work we did looking at Rhode Island and neighboring states, and this is showing you, these are small employers, so less than 100, and showing you what they think of the Rhode Island program, which is called Temporary Caregivers Insurance. This is after the program was put in place. And the point to note here is the tall bars are those who strongly favor or are somewhat in favor of the law. So those are the ones all the way to the left in each panel. The ones to the right are opposed or strongly opposed. And the point I want you to get here is among small employers after the program's put in place, there's a fairly large majority of people who are in favor of the law, only a small number who are against it. So that's some of I think, the best evidence we have so far that some concerns that people raise from the employer side don't appear to be terribly serious. Okay, how much time do I have? I want to know how. Okay, all right. So now I thought I'd talk just a little bit and really give you some of my opinions. I don't get a lot of opportunity to do this to this kind of body, but where we should go next. So I just thought I'd mention some of the issues that we come up when we think about expanding paid leave. The first one is it going to be a state policy or a federal policy? And my own view is for sure, if I had my choice, it would be a federal policy. I think there are lots of advantages, potentially savings in administrative costs, but also less concern, are states having to be concerned that they're putting themselves at a disadvantage compared to other states, and a variety of other factors. A complicated issue is the one of parental versus family leave. So parental leave would be leave for like new parents, so people who have a child or adopt a child. Family leave covers a broader set of things. So for example, taking care of a sick relative. And I think it's a political question which we end up doing, but I'll point out that there's some complexity there because what you might prefer if you were to design the ideal program for parental leave and the ideal program for family leave, they wouldn't necessarily look the same. So that's just an issue that to think about. There's an issue, should the entitlement be an individual parent entitlement or a family entitlement? And so in the U.S. on both the FMLA and on the state paid leave programs, it's an individual entitlement. So it's each parent has or each family member has a right to a given number of weeks, which is, I think, is the right way to go. There's issues of duration and wage replacement rate of the leave. I think we don't know enough to know the best answers here, but my own view is it should be partial wage replacement, so somewhere in the range, probably 55 to maybe 80%, maybe with a sliding scale depending on your income. to make it more affordable for those with low incomes. Personally, I would not be in favor of 100% wage replacement for a variety of reasons, one of which is you actually save some money. If you're not working, there's some expenses you're not incurring. There's issue of eligibility, and I like what the states are doing here in terms of having very broad eligibility. So unlike the FMLA, which restricts eligibility, okay, my time is up, which restricts eligibility to people working for fairly large employers, I think we want a general benefit. I have more to say, but I'm out of time, so thank you.
Thank you very much. Our next speaker is Ankita Patnaik. She is a recent Ph.D. in economics from Cornell University, I believe. Is that correct? And for the last year, she's been at Mathematica here in the district, one of our renowned research firms. She works primarily on poverty and social programs, and particularly in her dissertation, she did a lot of research on parental leave, and particularly she looked at Quebec and their new daddy leave. So we're anxious to hear from Ankita about that. Thank you.
Thanks very much, Heidi. So I'm excited. Sorry, thanks. I'm excited to share with you guys some results from my research on how encouraging men to take parental leave can change the division of labor in a household. Often when I give this talk, especially in the United States, people ask, well, why do we care about dads right now? In the US, we don't even have federally mandated maternity leave. And that's very true, and that has to be our first order issue. But one of the benefits of studying countries in Europe and Canada and all over the world is that in some sense we can leapfrog the trials and errors of other nations and kind of go to the best practice so far. So that's what I think we have to learn from this episode in Canada. In recent decades, as you know, we've witnessed some promising trends in the formal labor market. So male-female differences in education, wages, and labor supply have all shrunk considerably. However, a large gender gap remains in the area of caregiving that's done at home. We see this in multiple patterns. To begin with, mothers are much more likely to take parental leave than fathers. And in nations with generous parental leave, mothers take much longer periods of leave, which has the potential to hurt their careers. Married women continue to spend more hours in housework and childcare every day, and they also do different types of caregiving work. They do more of the routine and time-inflexible chores that can typically conflict with work and leisure. And we see this generally in household priorities. Even in dual-earner families, women's employment remains more sensitive to spousal working hours and relocation than vice versa. Some have proposed that paternity leave could be a possible solution. It would intervene at this crucial time that a couple is renegotiating their household roles and figuring out who does what in the household. It would give men kind of on-the-job training in caregiving skills, and it might enable some women to return to work earlier without compromising on the care of their child. And lastly, it would reduce the rationale for employers to discriminate against female candidates by assuming they're more likely to take time off than their male counterparts. But of course, men face considerable barriers to taking parental leave, the first of which is financial costs. Many families will take a big cut to the paycheck if men take time off. And men also worry about the career repercussions of taking time off. Even if they technically have the right to take leave, they worry that their employer is going to penalize them in terms of promotions or pay, and that their coworkers are going to resent them for having to cover for them while they're off. They even worry they might just be signaling the wrong thing about their ambition or how seriously they take their jobs if they take parental leave. Of course, in some cultures, there's still social stigma to men being caregivers as well. So when we're thinking about how to design policies to encourage men to participate in parental leave, we really need to consider two questions. So the first is, well, what kinds of policies encourage men to participate in parental leave? And the second, and perhaps more important, is, well, does it have a long-run effect? Does it really promote gender equality beyond the short period of parental leave? To examine these questions, I looked at a policy experiment in Canada. So let me give you a bit of background. In Canada, every new parent is entitled to a year of unpaid and job-protected leave, and most parents can convert some of that into paid leave. They can claim benefits from something called the Employment Insurance Program, or EI. It's a social safety net. It works a lot like the unemployment insurance program here in the States, except it also covers time out of the workforce to care for a newborn child. Now, EI provides about a year of leave for every family. Much of that is maternity, so it's just for moms, and some of that is gender-neutral family leave. So moms and dads get to decide how they want to split it between them. This is available across all of Canada. However, it turns out the EI program's not really utilized very well. So less than 1/5 of men take any parental leave at all under this program, and the vast majority of families don't even use all of the leave available to them. So they don't use a whole year of leave. So one province, Quebec, decided to do something about this. They wanted to roll out a new program known as the Quebec Parental Insurance Plan, hoping to solve some of these problems. So QPIP was really designed to ease the barriers that men face to taking leave. First, it made it easier to qualify, so the eligibility criteria was lowered. It improved financial compensation, so it increased the percentage of your wages that you could get back while you were on leave. And it also raised the maximum cap on the benefits that you could get while on leave. So in net, under the old program, you could get about $400 per week. Under the new program, you can get almost $800 per week. So it was a big increase. Crucially, the new program also introduced a daddy quota. So what it did was it took the year of leave that the whole family has and added 5 weeks that were reserved just for dads. So it's a non-transferable, use it or lose it quota. Either the dads use it or it just goes to waste. Now, the daddy quota has a strong rationale behind it. The first is that it sends this government message saying that we as a society really prioritize men spending quality time with their children. But it also changes the social norms around caregiving, and it changes men's bargaining position. Both their employers and coworkers are more likely to be sympathetic with men taking time off when that time is an individual entitlement just for the men, because you can't rationalize that their wife could have done it instead. I find that QPIP was very successful in getting men to take leave. This graph charts the participation rates of fathers in the decade around the reform. On the top, in the thick blue line, is Quebec. At the bottom, in the thin grayish line, is the other provinces. As you can see, in 2006, which was the first year of the new program, fathers' participation jumped from about 22% to almost 75%. That's a huge increase, almost a tripling of fathers' participation rates. Not only did more fathers take leave, but they took leave for longer periods of time. So on the left, under the old program, men in Quebec took about 2 weeks of leave on average. Under the new program, they take 5 full weeks of leave, exactly the amount of their quota. So this program was really successful in getting men to take leave. But the question remains, does it really matter in the long run? To examine that, I looked at time use data a few years after the reform. So a time diary essentially asks respondents to write down what they've been doing and where they've been doing it every 7 minutes for a 24-hour period. As you can imagine, it paints this really nice idea of what an average day in a household looks like. It's very detailed information. I looked at families that have kids between the ages of 1 and 3. So they're not on parental leave right now, but they've potentially been exposed to it pretty recently, and they're still facing the demands of very young children. As Chris very helpfully explained a difference in differences strategy for me earlier, that's exactly what I use. So I compare fathers in Quebec who are exposed to the new program versus fathers who are exposed to the old program, and my control group is just parents in other provinces. I find that families that were exposed to the new program are really very different in their time use patterns. Moms and dads both spend more time in childcare per day. Dads spend about 15 minutes more in housework every day, and moms save that time in housework. Dads spend about a half hour longer physically at home. Moms spend about a half hour less physically at home. Moms spend an hour longer in paid work every day. And among employed moms, they're more likely to be full-time employed than part-time employed, and their time at the workplace increases. So as you can see, it was only 5 weeks. It's a relatively small nudge, but at a really crucial time that encouraged households to reorganize their division of labor. The takeaways from this research project are, if you want to promote gender equality within a couple, we need to start early. Start with the birth of their child. Start by encouraging men and women to share caregiving responsibilities pretty early on. But also, in designing a policy, if you want men to take you up on the offer, you have to ensure that there's generous compensation and that time has been reserved specifically for men. Thanks.
Thank you very much, Ankita. Our next speaker will be Patricia Stoddard-Dare. She's an associate professor of social work at Cleveland State University. She also coordinates the Master of Social Work program there, and she got her social work degrees at Washington University of St. Louis. And she has been studying health effects as well of public policies, and we will hear from her about her research on the importance of paid sick days. And I do want to say there are seats up front. We had reserved them earlier, but now they're available to anyone. So if you don't have to stand, you may sit up front. Thank you.
First, I'd like to acknowledge my research partners, Dr. Quinn and Dr. DeRenier. Until recently, very little research has examined the impact of paid sick leave benefits on healthcare-seeking behaviors. The research findings I'm going to share today include recently published findings and also findings that are forthcoming in publication using the same methodology that will be publicly reported here for the first time today. Our research uses data, a representative sample of 18 to 19,000 U.S. adult employees, age 18 to 64, from the 2013 and 2014 National Health Interview Survey collected by the Census Bureau. All the findings that I'm going to share show statistically significant differences between workers with and without paid sick leave. In all of our analysis, we control for 13 variables which might otherwise explain our findings. Given the methodology that we use, we can generalize our findings to the U.S. population of working adults, age 18 to 64. In our research, we found those who, without paid sick leave, are more likely to be male, unmarried, less educated, Hispanic, hold service occupations, work part-time, lack health insurance, have fair or poor health, have a limiting health condition, and also have lower incomes. We also found that workers without paid sick leave are more likely to delay and forego needed medical care due to concerns about cost for both themselves and for their family members. Although the lowest income group of workers without paid sick leave have the highest risk of delaying and foregoing medical care for themselves and their family members, even workers in the highest income group, earning over $100,000 a year, are still 3 times more likely to delay care and 2 times more likely to forego needed medical care if they lack paid sick leave. The American Dream Ideal advocates that those who obtain a higher education and work harder will have a prosperous life. Our findings show that those with a higher education are more likely to have paid sick leave. However, we also found that both the well-educated and those with lower levels of education both experience higher likelihood of delayed and foregone care if they lack paid sick leave. In other words, education and income alone do not protect workers from delays and foregone care if they don't have paid sick leave. This is important because delaying and foregoing needed medical care can lead to more complicated and expensive healthcare conditions. In support of public health goals, we found that U.S. workers with paid sick leave are more likely to take off time to care for themselves when they're sick or injured. Taking time off work to recuperate when ill is associated with shorter recovery times and reduced complications. The ability to stay home from work due to illness allows workers and their dependent children to self-quarantine when necessary without concerns about income or job loss. In our research, we also found that workers without paid sick leave are less likely to receive important preventative health care services. For example, we found those without paid sick leave are less likely in the last year to have seen a doctor, to have received a flu shot, to have had their blood pressure checked, to have had a cholesterol screening, to have seen a dentist, to have discussed a diet with their doctor, and they're less likely to have received a tetanus shot within the last 10 years. In terms of healthcare affordability, we found working adults without paid sick leave are less able to afford mental health care, dental care, eyeglasses, specialist care, and needed prescription medication. Again, these findings hold true after controlling for income and other relevant variables. Similarly, working adults without paid sick leave who have received a medication prescription in the last 12 months are more likely to have bought prescription drugs for another country to have saved money, and they're more likely to have used alternate therapies to save money. It's important to understand the economic situation of families who lack paid sick leave. Those who lack paid sick leave are 3 times more likely to be in poverty. This is controlling for education and other factors which you would think would impact poverty. They're also significantly more likely to have higher family medical costs than those with paid sick leave benefits. And they're more likely to have problems paying their medical bills compared to those people who have paid sick leave benefits. This is particularly concerning given the fact that medical debt is a leading cause of bankruptcy. So we have a situation where vulnerable workers who lack paid sick leave are more likely to delay needed medical care, including preventative care, are more likely to forgo needed medical care entirely due to cost for both themselves and their family members. But they're more likely to have more expensive care, which they're less likely to be able to afford, which might help explain our final set of findings. Those without paid sick leave are more likely to use government-sponsored welfare. Specifically, adult workers without paid sick leave are more likely to receive income from state or county welfare, to receive government-sponsored rental assistance, to receive food stamps, and to receive other welfare assistance such as transportation and child care supports. Here we can identify 7 core problems that paid sick leave is attempting to address. Number 1, reducing the spread of contagious disease. Number 2, providing workers and their family members with an opportunity to receive preventative medical care without risking job or wage loss. Number 3, providing workers and their family members with an opportunity to recuperate when they are ill and to prevent escalation of illness without risk of wage or job loss. Number 4, to reduce economic insecurity and poverty associated with job loss, wage loss, and medical disability among workers. Number 5, to reduce health disparities. Number 6, to reduce the cost of health care. And 7, potentially reducing the need for welfare. Some interventions that can be considered to address these 7 core issues include potentially incentivizing voluntary paid sick leave for businesses, implementing workers' right to request flexible work hours and fair scheduling of work hours, expanding access to affordable after-hours and weekend healthcare services for those seeking routine and non-emergent care, expanding the use of health clinics in schools and in places of work, expanding the use of telemedicine, and of course, mandatory paid sick leave. Voluntary paid sick leave policies leave gaps in coverage, making them inadequate in protecting public health, the health of employees, and their family members. They're also inadequate in protecting the financial well-being of workers, healthcare providers, and taxpayers. A paid sick leave policy hoping to address the issues discussed here today must include part-time workers, small businesses, and private employers. And I have a handout with my findings as a summary for those who are interested.
Thank you very much. Next, we will hear from Jenna Stearns. She's a graduate associate at the Broom Center for Demography at the University of California, Santa Barbara. She's working on her Ph.D. in economics, and she's sharing with us today some of her results. She's particularly interested in how what happens to you as an infant affects the rest of your life, and so she's particularly interested in how temporary disability insurance and maternity leave can promote child health. And I think she's one of the first researchers I know to have studied this fantastic old program, temporary disability insurance, which 5 states have had for a very long time. So welcome, Jenna.
Thank you. I'm actually going to talk a little bit about the effects of temporary disability insurance and maternity leave coverage through that program on infant health. And then, in light of some of the other things that have been talked about, I'm going to discuss very briefly some findings I have with another colleague at UCSB, Corey White, on the effects of paid sick leave for workers who don't actually gain access to that leave, so indirect public health benefits. That again expands upon what Patricia said earlier. But first I want to talk about the effects of paid maternity leave on infant health. I'm going to look at the first source of statewide paid maternity leave benefits in the U.S. And this leave resulted from a change to the temporary disability insurance program in 1978. In 1978, the Pregnancy Discrimination Act was passed by Congress, and one of the implications of this act was that the 5 states with temporary disability insurance program started to cover maternity leave benefits. So those 5 states are California, Hawaii, New Jersey, New York, and Rhode Island. They all have similar programs. The details vary a little bit, but essentially they're all partial wage replacement insurance plans for workers. And essentially all private sector workers pay into the system and are eligible to claim leave. So the coverage rate is very, very high. For pregnancy, there's just a fixed amount of benefits available, about 6 to 10 weeks. In California and New Jersey, for example, women can get up to 4 weeks of antenatal leave, or leave taken before the birth of the child, and up to 6 weeks of leave after the birth. So importantly, this policy covers both leave before the child is born and after the child is born. So I'm going to try and identify the effects on infant health at birth using data from birth records. And similar to Chris and Ankita, this is going to be a difference in difference strategy where I'm going to compare outcomes in states with temporary disability insurance programs to a group of states without before and after the implementation of the policy. So the nice thing about this is we can just summarize the main results graphically. In this figure, I show the share of low birth weight births in the state. The solid line is the states with temporary disability insurance programs, and the dashed line is a group of control states. Low birth weight is a negative outcome, so we would like this line to be going down. And you can see that before the Pregnancy Discrimination Act goes into effect in 1978, the birth outcomes in these two groups of states are very, very similar. There's been a lot of improvements in health at birth over this time period due to advancements in medical technology, et cetera. But the point is that these treated and control states are tracking very similarly. However, once pregnancy leave becomes available in 1978 or 1979, these two sets of groups diverge pretty substantially, and we can attribute that to the effect of having access to paid maternity leave. So this finding is robust to different specifications, different control groups, et cetera. Overall, there's about a 3% decline in the share of low birth weight births in the state, and about a 6% decline in the share of early term births, so births that don't reach full term. What's really interesting about this finding is that the effects are substantially larger for low SES mothers, primarily unmarried mothers and minority groups. And as Chris said, other research on the effects of unpaid leave in the US has found that the effects are concentrated almost entirely among higher SES women. So this is suggestive of the fact that these low SES women really need at least partial wage replacement to be induced to take leave. Or in other words, they would like to be taking more leave, but in the absence of a partial wage replacement or a full wage replacement policy, they can't afford to do so. This is also important because this is potentially a very easy way to reduce some of the health disparities in birth that we see across socioeconomic groups. Low SES mothers have much more unhealthy birth outcomes than higher SES mothers even today. So why do we care about birth outcomes? Birth outcomes are strongly correlated with a host of longer-term outcomes. Higher birth weight leads to higher IQ, higher educational attainment, and higher earnings in adulthood. Higher birth weight as well as longer gestational age are both associated with improvements in health, both in childhood and in adulthood. So even small changes in birth outcomes can lead to important effects throughout the life cycle. The other important thing I want to mention is that presumably effects on birth outcome are driven by antenatal leave, leave taken before the child is born. One mechanism we think is important is a reduction in work-related stress, both physical and mental stress. The paid family leave policies that have been introduced more recently cover leave taken after the child is born only. So as we're going forward, I think it's important to consider the fact that antenatal leave can have very important effects on infant health as well. The second thing I want to touch on is the effects of mandated employer-provided sick leave. So this I'm going to focus on worker health. Government-mandated PSL policies, as has been mentioned, are relatively recent but are becoming more common. The earliest was in San Francisco in 2006. I'm going to look in this paper at DC and Connecticut, and there's been even more than this recently. Unlike with temporary disability insurance, the burden of these policies falls on employers. Employers have to pay the cost of providing the leave to workers that don't already have access to leave. And so what we're interested in this paper is, can these policies benefit workers that don't directly gain access to sick leave? And this could occur for two reasons. One, some of these policies don't apply to all workers. For example, Connecticut's employer-provided sick leave policy only applies to workers in service occupations. Workers in service occupations are the least likely to have access to leave, so it still affects a significant proportion of the population, but not everyone. The second is about 60% of workers in the US have access to employer-provided sick leave already. And so they're not going to directly gain access to more leave under these policies. So what we want to know is, can these workers that don't gain access be indirectly affected? And the idea is that if I can now take more sick leave, I'm less likely to go to work sick, and therefore I might be less likely to spread my illness to my coworkers and customers. And that's exactly what we find. Using a similar identification strategy to the earlier paper, we find that when these PSL policies go into place, there's about a 0.3 to 0.4 percentage point reduction in the illness-related leave-taking rate. So this is leave-taking only for illness-related reasons. This is a big effect. It's about a 10 to 15% effect. And it really is a public health story. This decline in aggregate leave-taking is driven by the workers who do not gain access to additional leave under the policy. And we can see this directly in Connecticut because we know only service workers should be affected. There's also no effects on leave-taking for non-illness related reasons. And this is in line with similar work by some economists at Cornell who show at least a correlation between implementation of PSL policies and reductions in influenza rates using Google flu trend data. Obviously, influenza is not the only form of contagious disease, but is one we're particularly worried about and is particularly contagious. So I'm out of time, but I just want to say the implication of these policies is that even though they don't affect all workers, paid sick leave policies, mandates, can have substantial effects on public health. And it's important to consider these effects when we're weighing the benefits and costs of these policies, because this is actually a way that the direct cost to employers can be reduced. If their workforce is in general healthier, they're more productive, and therefore it's going to offset some of the direct cost to providing the leave to workers to begin with. Thank you.
Thank you very much, Jenna. Our next comments are going to come from Jerry Jacobs. He is a professor of sociology at the University of Pennsylvania, earned his degree at Harvard. He is the founding president of the Work and Family Researchers Network and is now our executive officer. And he's written widely about this topic, and we've asked him to just make a few remarks about the implications of some of this research for public policy in the U.S. going forward. Jerry.
Thank you, Heidi, and thanks to all the panelists for their excellent research and very concise presentations. Makes my job batting cleanup much easier. Just a word or two about the Work and Family Researchers Network. We have 700 researchers and scholars from across the country and around the world convening here in the District of Columbia. We have 40 researchers from 45 different countries represented. So while we've kind of been focusing on the United States as all the state and local initiatives as kind of a laboratory of democracy, example with the Canadian example as the one international point of comparison. In fact, countries around the world have paid family leave, they have sick leave policies, and we can draw from their experience as well as we can draw from more local experiences. But in talking to congressional staffers, it's very clear that when you say we have examples of these things from states and localities across the United States, and let me tell you how these things are working, eyes open up and ears open up. And the kind of research that we've heard from today, I think is very pertinent to that. I have 3 or 4 main points that I want to make. One is that work and family area is really multifaceted. In our organization, we have people who are leading experts on sleep, stress, child care, elder care, organizational change, employee morale. The range of topics is really really amazing because, face it, work and family touches on so many aspects of our lives. It affects our families, it affects our health. As we've heard from these excellent presentations today, it affects economic participation rates of parents, and consequently, there's so many pieces of this that any single evaluation study is going to only capture one piece of the multifaceted ramifications of these kind of changes. Second of all, I've just really enjoyed, as a research wonk, I've enjoyed all of the technical details, and I really look forward to getting the papers and studying them more carefully. But I also want to make the point that not only do we need continuing research on all the different aspects of work and family policies, but we also need to pay careful attention to how these policies are designed. And that's the other important takeaway that I took from these presentations. If you have a carve-out for fathers, that's going to affect fathers' participation, and that has potentially long-run implications for the gender gap in wages, for gender differences in careers, for the representation of women in boards of directors and executive suites of major corporations. In the short term, I think the legislation that is being discussed doesn't focus on that in the United States. But I think we really do need to pay careful attention to, when we do, get over the mountain and get some of these pieces of legislation passed, how they're designed matters a lot. So paid family, the Family and Medical Leave Act in 1993 was a piece of milestone legislation, but in evaluations afterwards, we learned that there was a lot of gaps in coverage. So if you're not employed for over a year, if you're working for a small employee, you're not covered. So it turns out that there's a disproportionate likelihood for the people who need the policies the most to be in the categories where they're least likely to be covered. Again, I'm not saying that the people who got that legislation written and passed weren't paying attention. Maybe it was the best they could do at the time. But going forward, we certainly want to pay attention to how big the employers have to be. What's the replacement rate? Do we focus on fathers in addition to mothers? Are we doing a contributing kind of insurance model, which I personally feel is very compelling in terms of political support? People feel the idea is, I've paid into this. This is money I've banked for when I'm going to be sick or when I'm going to need a leave situation, so I'm entitled to it. The way Social Security, I think, has become, a really important bedrock in American public policy. I think designing paid leave on that same kind of insurance model is really a good way to go. It turns out that employee contributions are expected to be something on the order of $1.50 a week. Okay, so the cost of paid parental leave is an order of magnitude smaller than the kind of contributions necessary for Social Security. But the point is that that model, I think, is a good way to go. Two more points on this patchwork that we have right now. On the one hand, from the researcher's point of view, it's a great opportunity. We can do our difference in difference models, as you are learning about if you weren't familiar with that already. But from the employer point of view, I've participated in business discussions at the Wharton School of Business, which is located at my university. And frankly, one of the concerns that national employers have is that they don't want to have to deal with different rules in every different city and every different state. So I think there are really compelling reasons for having these policies on a national basis. Just to kind of, I hope I'm not hitting this point too hard, but the idea is when you go to a Chipotle, you want to be able to be confident in the quality of the food as well as the fact that the servers are not going to be sick, and you want to have the same expectations whether you're going to a restaurant in Philadelphia or Chicago or San Francisco or in the District of Columbia here. So there are lots of compelling reasons to want to have these policies on a national basis. A final point I want to make, see if I can get this in my one remaining minute. There's definitely pushback from employers. And what I take away, as best I can glean from listening to them, is they'd just rather have the flexibility to do this themselves as much as they feel like for the kind of employees that they want to benefit, and not have to fill out paperwork and not have to have another set of government rules. I testified about paid sick leave in front of the Philadelphia City Council, not the last time that it actually got to be law, but the first time when it got vetoed by the mayor. And the person ahead of me was speaking on behalf of the Chamber of Commerce, and he said two things. First of all, we give paid sick leave to all of our employees, and second of all, we can't possibly afford it because we'll all go out of business, okay? So there's definitely pushback on the front end, but I was like so nervous I was trying to get my own remarks together, and I was basically didn't have the opportunity to say, those two things can't be true at the same time. I think the evidence is clear that once the legislation is passed, it's just another thing that business has to deal with, and they move on to the next concern. It's not an enduring source of difficulty and problems for companies to deal with. And I think we've heard from each of the presenters, each in their own way, there's so many national benefits to the economy, health, women, families, children, that there's certainly a lot of positives that we need to put on the scales in addition to whatever inconvenience there might be for employers in the short term.
Thank you very much, Jerry. So now we have a period of Q&A, and you'll note that we're videotaping this because we will be putting that on the IWPR website, and I think also the WFRN website.
We'll put a link.
We knew we had a sort of capacity crowd here today, and we wanted opportunity for everyone else to be able to see it. So that means when you ask your question, you're going to be looking for a microphone, and the person with the microphone is standing up, and catch her eye. So while you're working on your question and catching her eye so she can give you the microphone, I thought I'd ask a couple questions because I know you need a little time to warm up. So Chris, you were going to talk about what your thoughts about financing, and Jerry has just mentioned that he likes the method of using social insurance, and I wondered what you want to tell us about your thoughts on financing.
Sure. So I was at a session yesterday where I was asked if I could wave a magic wand and have whatever I wanted, how would I finance it? And I actually would finance it differently if I had a choice, and that would be through general revenues. And the reason for that is that's kind of the broadest based way of financing. So one of my views on family leave policies is they're a family value policy, and I believe in kind of paying for those in the widest possible way. Now, with that said, I think realistically, payroll taxes are the more likely way we can do it, and I'm fine with that. What I would not support is the employer tax incentive model for a variety of reasons. So the first is we won't get to universality through that, and I think universality is important. The second is the big benefits are going to go to the employers who are already doing this, right? The ones who are providing leave, they'll get the tax incentive, and others who don't provide the leave won't. So general revenues would be my first choice, but payroll taxes are probably the way we're going to end up, I would guess.
And then for you about Quebec, I had a question. You said that the 5 weeks of daddy leave is beyond the 52 weeks, and yet most families don't use the 52 weeks. So how did the dads get that 5 weeks?
Yep, so it's really interesting. So before the new program came into place, the whole family got a year of leave, but on average, dads didn't take any leave, and moms would use about 10 months of leave, which means 2 months was just being left on the table. And then Quebec added 5 weeks of leave. It doesn't technically have to be at the end of the year. It just means the total expanded by 5 weeks, and dads began to participate. So what's really interesting about this is that it means under the old program, there was always 2 months of leave that dads could have taken, but it wasn't reserved for them, and it didn't come with this government message saying, you know, these are our priorities. So just adding 5 weeks that they already had, but saying it was an individual entitlement for them really encouraged men to participate. It's kind of fascinating psychologically.
And at the same time, the benefits were raised for both men and women. Right?
Yeah, the benefits were raised for men and women, exactly.
So potentially the women took more time also.
Mm-hmm. Yeah.
That idea that it's great if you label it is related to, that idea that it's great if you labeled it relates to something that I think you said, Jenna, that in Connecticut, the sick leave program only covered people in the service industry, but the people who took took more paid time off and therefore had less sickness were not the service workers. How do you explain that?
Yeah, so what I was finding is that service workers should have taken more leave under the policy, right? They had more leave available to them. Other workers, non-service workers, shouldn't have experienced a change in coverage, and yet they actually took less leave. So that suggests that it's a public health benefit. Those non-service workers are less likely now to get sick, and therefore they're less likely to need to stay home from work, whether or not they have access to leave.
So they were driving the effect of needing less paid sick days to cover illnesses because there was less illness in the workplace, because now when service workers got sick, they could take off.
Yes, there's actually some literature or survey literature that has suggested that something like 60 or 70% of workers report they've gotten the flu from a colleague, and over 80% of workers have reported getting sick from a colleague. So this idea that disease spreads within the workplace and within service sectors is very real, I think.
We did a similar study on when H1N1 was around, and we found that public sector workers, who are a lot more likely to have paid sick days than private sector workers, had more illness around spikes, you know, when the flu first comes, more time off, but then they're better and they don't take time off. Whereas in the private sector, what happened is they didn't take as much time off at first, but then they drag. So net, private sector workers took more time off in the H1N1 epidemic than public sector workers, who were more likely to have paid sick days. So that is just another corroborating study. Who's got the microphone? Anybody have comments or questions? I'm sure you do. I don't know where the microphone is. Oh, okay.
Hi, thanks. This is very interesting. I'm Kate Gallagher-Robbins. I'm with the Center for American Progress. 2 questions that I'm going to put out there. One for Chris. You said that you would design parental leave and family leave differently, and I'm wondering if you can talk a little bit about that. And then one question for, I think, Heidi and Jenna together. In the TDI program, so there were 5 states in the late 70s, right? And it sounded like no states between now and then. And so could you guys talk a little bit about kind of the politics around that, and is there an opportunity for expansion, because it seems like it has some really good benefits, and kind of why that hasn't really grown in the last almost 40 years?
So my point was that if you were to design an optimal policy, and I'm talking about purely in the absence of any political concerns, it's not obvious that you would want the same policy for parental leave and other forms of family leave. So to give you an example, you know, one concern employers will have is that you're taking the leave when maybe you don't really need it, or you're taking a lot of it. So something like a birth or an adoption, it's very easy. You know, there's no question about whether there's been a birth or an adoption. Now, if I'm taking care of my parent who has some kind of sickness or dementia or whatever it might be, that's harder to measure, and so, we might want to have different incentives or different durations. With that said, there's a political concern. It may be easier to get political support for a policy that combines the two, and so then you might want to make some compromises to do somewhere that's in between what you might do ideally if you were doing them separately.
Thank you. Jenna, you want to tell us something about the history of these TDI programs?
Sure. So there's 5 states with TDI. There haven't been any more since the late 60s. TDI covers short-term work absences for illness and disability that aren't covered by long-term disability. So they're not permanent, and they also aren't work-related. So they're not covered by workers' comp. So this really is an important, I think, social insurance system for workers in these states. I don't know why they haven't become more common. I would imagine it's because they're somewhat costly to run. What's interesting, I think, is that as paid family leave has developed, there are now 4 states with paid family leave programs. There are 4 of the 5 states that also have temporary disability insurance. So these are states that have strongly, signaled that they are very much in support of worker protection and social insurance policies. Other states have been a little bit slower on these margins to take action, and I do imagine a lot of that is funding concerns.
I think from what I know about it, a number of them were started shortly after World War II. States had enormous surpluses in unemployment insurance because we thought there would be a big bust after World War II, and there wasn't, because people had all this money saved up and they went out and spent it, and so the economy was booming, and they didn't need the UI, and the federal government actually had a program of technical assistance to the states telling them how to set up temporary disability insurance programs, so a few did so. I believe Hawaii was the last one to come in, and theirs is different because in Hawaii there is no public program, there is only private insurers, and as long as you hire as an employer, you're required to get one of those insurance companies. You just have to get one that has at least meets the minimum. And so it's all private insurance, and so it's very different. But the public insurance ones, I think, essentially stopped because the private insurance industry started realizing it was cutting into their market. You can, as an employer, buy short-term disability. IWPR buys it, for example. And about 40% of workers in the United States are covered, many through these voluntary, private insurance policies. The problem is that, of course, the employers who are most likely to buy it are the ones who have the higher skilled workers who have invested a lot in their workers and would have high turnover costs, high recruitment costs. And so, as usual, it's the more advantaged who get that voluntary benefit. So it is great in the states that require all employers to have it. And another great thing about it is the employer size who has to have it is 1. If you have 1 worker, you have to have it, whereas with FMLA, as you know, it's 50 or more workers before you get the job-protected leave. So it's a pretty great old-fashioned program, which should be more popular today, in my view.
Hi, I'm Greg Kimbrough with ADP, and I had 2 questions. The first is regarding the sick leave, the effects of sick leave that you were looking with the NHIS data. You noted that there were a lot of relationships between having sick leave and health outcomes, and I was wondering if you were able to sort of fully control for the quality of health insurance and health coverage people have, since that would be highly related, and maybe another pathway that would be seen, and maybe that there are just some things that are kind of hard to control for really intricate quality details of that. And the other broader question I have is that to relate this back to my research, which is on vacation, and I ask this because we've been talking about sick leave and parental leave and family leave, and the U.S. is also one of only a handful of countries in the world that doesn't have mandatory vacation or holidays. All the other countries that lack mandatory federal vacation are very small and not developed. So the U.S. is sort of a standout in that, and I guess at this policy event, I wonder if there's any sort of policy any sort of push. I don't see that there is for any sort of vacation leave for people in the U.S. For mandatory vacation. So, thank you.
In terms of quality of health insurance, that's something that we really wanted to look at. We did measure whether or not people had health insurance, and we were able to say where they got the insurance from, but we couldn't assess the parameters of their insurance policy. Does someone else want to answer about vacation?
If I could just jump in on the vacation end of things, we have a panel on Thursday on vacation stuff at the conference. And there's actually a lot of interest in the hospitality industry in pushing the importance of vacations. But I don't think it's reached a critical mass in terms of legislation. There is quite a bit of momentum for paid sick leave, for paid family leave, and there's also a lot of growing interest in another topic that we haven't touched on today, which is scheduling issues, having predictable work weeks. But I think that it's, again, there are people who are kind of have their finger on the pulse of legislative possibilities more than I do. But my sense is that those three are kind of ahead in the queue of vacations at this particular point in time.
I would just like to add that originally when we helped propose the paid sick days bill to Senator Kennedy's staff, Holly Fechner was his labor policy person then, we proposed 5 days of vacation plus 5 days of sick leave, or maybe it was 10, it might have been 10 of each actually. Anyway, it was knocked down to 10 days of sick days and then 7 days of sick days, which is where it stands now. But it's very unpopular. Gallup just released a poll. I think it was like 77% believe employers should be required to provide 2 weeks of paid vacation. About the same number should be required to pay paid sick days. I think it was 7 days, I'm not sure. And also, they were all, vast majority, 2/3, I believe, in favor of the new overtime regulations, which mean if you make $47,000 or less, you'll be, your employer will have to pay overtime no matter what you do. And a lot of, and the minimum wage, a lot of support for that as well, going up to $15 an hour by 2020. So I think it's kind of a missed bet on the part of the advocacy community to not go after paid vacation. And, you know, for those who may not know, in the European Union, it is a minimum, I believe, of 30 days, which is like 6 weeks. It's pretty nice. Who had the question? Somebody up there, yeah.
Hi, my name's Willetta, and I'm with the World Policy Analysis Center at UCLA. My question's for Jenna. You touched briefly on how maternal stress also impacts some of the birth outcomes that you're interested in and how that might have implications for leave ahead of the birth. I guess I'm also curious just about any effects in terms of mitigating stress, just the expectation and the security of a postnatal leave might have, and any efforts underway to kind of assess that. Thank you.
Yeah, so there are certainly expectation effects, I think, that could affect birth outcomes, even if the leave is taken after birth. The lack of stress and having to worry about going back to work is, I think, a big one. There also could be income effects. You know, if you're not going to lose 6 weeks of income, then you're less stressed about that as well. It's a little bit hard to separate those stress mechanisms. So I can't do that in my work specifically, but there's certainly some very good evidence in economics and I think in the epidemiological literature as well that stress has very important implications on birth outcomes as well as later outcomes, both for the mother's health and her mental health as well as for the child's health, both at birth and then later on in the child's early life. So those are definitely important. I think there's definitely a good argument that antenatal maternity leave has an important impact, especially for these low SES mothers, through reduction in physical stress. These mothers are likely to be in jobs with a lot of adverse working conditions, standing all day, long shifts, heavy lifting, etc. They're not necessarily sitting at a desk all day, which when you're 9 months pregnant is much harder on your body. But I do think that the reduction in stress, knowing that you're going to be able to take time off, you're going to have at least a partial wage replacement for that time is an important mechanism as well.
Other comments or questions? Microphone is coming
Thank
toward you.
Good afternoon. Ms. Stearns, I believe you were talking about paid sick leave in Connecticut. Yeah. As you were talking about that, I was thinking, I was a service worker in Connecticut, and I don't recall any awareness of it not too many years ago. And I was curious if you had any data, any numbers about worker awareness, or if anybody else, in a similar manner, for local local regulations or rules in that patchwork, how workers are not aware, as opposed to if it was on the federal level, they would be aware. Thank you.
There's a lot of public awareness that goes into the implementation of these policies. Although one issue that we have with analyzing, before and after policy implementation is that we think take-up is increasing over time. So, right after the policy goes into effect, it could be people don't know about it, and it also could be people are afraid to be the first to use it. So you can imagine a situation in which you don't want to be the first person to take maternity leave at your firm, or you don't want to be the first person to utilize the sick leave benefit at your firm. I think in the case of Connecticut, there was a pretty strong public awareness campaign to distribute information to service workers about their rights. I can't speak specifically as to how effective that information was, but there was a substantial amount of kind of a public awareness campaign that did go on.
And what year was that, Jenna?
2011.
And what size firm? All service firms, or?
Yeah, most service firms, the rate of accrual depends on firm size. So smaller firms, workers at smaller firms get less total leave because the accrual rate is a little bit smaller. The other thing I should mention is that there is, after the policy goes into effect, it takes some time for workers to be able to actually accumulate the leave. And so in the analysis that I showed, we actually accounted for that time. The estimates I show you essentially move the start time from the date the legislation was passed to the date that workers could have taken their first sick day, essentially.
If I could just jump in on that, there's evidence across the board on people not knowing the opportunities that, the policies that they might benefit from. I'm thinking of research by Ruth Milkman and Eileen Applebaum in California, which basically showed that lots of people were eligible for family leave and didn't take advantage of it because they didn't know about it. I don't want to cite you specific statistics because I don't want to get them wrong, but that's true, of the best run programs, and so worker lack of knowledge is definitely a consideration.
Another comment? Ariane? You have to put your hand up really high if you want the person with the microphone to see you.
Ariane Higovish, Institute for Women's Policy Research. Given that in Quebec, 70% of fathers did take up leave, and I think in Canada, in California, it's about 30%. What did they do to get out the message? How was this generally received by workers or the public?
So interesting. Thanks. As you know, the parental leave programs in Canada, as I mentioned, are run as part of a general social safety net. So if you're aware of the unemployment insurance in Canada, you're essentially aware of the parental leave program because the way to access the benefits, the pamphlets, everything is exactly the same. So it's less a case of lack of information because it's part of a program that's been running for decades, essentially.
Hi, I'm Melissa. I'm doing my Ph.D. in the Netherlands, and I have a question about the parental leaves in Quebec. Because you said, on the one hand, you have the that's all the leave is lumped together, and then they changed it into that there are 5 weeks for fathers. But if I'm not mistaken, in Sweden, there is a form of leave that it's even different, because then if fathers take up leave, like the 5 weeks, then there will be additional leave added to it. And I was wondering, have you any idea whether they consider that in Quebec, and do you have any thoughts on that type of leave?
Yes, it's referred to as a gender equality bonus, I believe, in Sweden, where if the dad participates, the total amount of leave, actually, the whole pie increases. As far as I know, they did not consider that in Quebec. I actually think the gender equality bonus is a relatively recent addition in Sweden, and Quebec was discussing this policy back in 2001, so they probably just hadn't heard about it back then. Interestingly, actually, I believe the research coming in from Sweden says that the gender equality bonus didn't have a big impact on dads taking leave, but it was like the second or third reform that was encouraging fathers to take leave, because they introduced one daddy month, then they introduced a second daddy month, then they introduced the gender equality bonus. So that third reform didn't have much of an impact.
How are same-sex couples dealt with?
In Canada?
Yeah,
Quebec?
specific. I mean, when you're saying
Yeah.
daddy, like what if it's two daddies or
Great
no
question.
daddy?
So I know that they definitely qualified. The family qualifies because, as you know, the program covers both birth and adoption. So I guess the same-sex adoption is treated exactly the same as a heterosexual couple adopting a child. As to who gets the maternity leave and who gets the paternity leave, I'm not sure. I imagine they self-designate so that the total amount of time given to the family is the same. Yeah. But don't quote me on that. I don't know.
Any other comments or questions? Mr. Vacation Analyst is asking again.
One more question about the Quebec program. So you mentioned that
Can you stand up so we can have you on film? Thank you.
you mentioned that that it was important to get started early for the time use, right? So were you able to identify different effects for the first child versus subsequent children in terms of the impact on the fathers?
That is a great question. Yes, I did. The program did have a much bigger impact for if it's your firstborn child than if it's your second or thirdborn child. And that is, I mean, very kind of intuitive, right? It's your first time experience of having the child, so you're less set in your behaviors, et cetera. Of course, typically fathers having their first child also tend to be younger, so it could be a cohort effect in terms of social norms, et cetera.
If I could make one comment, I think we want to be a little careful about the notion of, kind of the daddy quotas or the leaves that are specifically for fathers. One of the reasons this has been put in place in Europe, and I'm guessing in Canada, is they had what amounted to a family entitlement, and it led to a very gendered division of leave. Now, that's not to say we're not gendered in the U.S., but one of the notions of having an individual right is at least it creates an expectation that each individual potentially will be taking time off. Now, we're not fully succeeding with fathers, but I think we want to be careful about going to a system where we're saying, here's a pile of leave. Theoretically, it goes to either parent, but practically it tends to go to the mothers. And okay, now we'll put a little add-on to try to get fathers to do it. I mean, that may be the best way to go, but I think we want to be a little cautious about making, about making that assessment.
Anyone else? Any other comment? Yes, Kate.
One question about the Quebec policy, and I apologize if this isn't your presentation. So obviously this presumes a two-parent family and extends the total amount of leave, right? And so what Chris was just saying struck me, if we're thinking about rights for individuals, and in this case individual parents, is it the case that what if it was a single mother? Would she get less total leave time, and ergo the child has less total time with a parent at home because she doesn't have either a married partner, I don't know how they're dealing with cohabiting, et cetera, but...
Great question. So multiple points. in Quebec, cohabitating parents, as long as they are the birth parents of the child, are treated the same as married parents. So it's really not contingent on your legal marital status. I should say my analysis actually doesn't look at single parents, particularly because I was looking at how you share resources within the family, so it's a moot point to look at single individuals. I believe that that a single mother, for example, would get the total amount of family leave, so that would be the maternity leave plus the gender-neutral family leave, but she's not entitled to the daddy quota, which is the extra 5 weeks. Having said that, as I pointed out before, most families don't use all of the total leave, so.
One additional dimension that I haven't heard brought up is that there's been some concern in the literature for impacts on hiring decisions because of the presence of leave and the take-up by women and men differently of the leave. And so as we're talking about this, constructing a single pool or having incentives for fathers, could you comment on how that might affect how men and women are treated in the labor force and in those sorts of issues? We do have some economists here, I suppose.
Well, I'd be happy to comment on that. It is one reason why our Family Medical Leave Act of 1993 is designed to be an individual right. Any worker who meets the hours and so on and works for a covered employer and has the requisite type of family or personal illness occurrence is designed the way it is, to include own illness and not just caregiving, because believe it or not, own illness is pretty the same among women and men. It's true that men don't have babies, and so you would think that women might have a lot more own illness if you count the babies, but actually men get into more fights, they have more accidents, they have other issues. So it turns out to be pretty equal over the lifetime if you're just looking at illness. And it's only the caregiving that will be, disproportionately female. And so it was felt that one way to make that law more gender neutral was to make sure illness was included. Plus, the more kinds of family members you're caring for example, your older parents, one of the big revolutions in care has been that many, many more adult men are taking care of their parents than they used to. It used to be the wife who took care of her parents and her in-laws, and now he takes care of his own parents. So that's a change. So it's one reason to have a lot of relatives in that bill, and it's one reason to have sick leave in there is to try to make it more gender neutral. But, if other people want to comment, please feel free.
So that's a great point. As I was saying, encouraging men to take parental leave should reduce the rationale for employers to discriminate against women for 2 grounds. So if you're comparing a very young female candidate against a very young male candidate, you're less likely to assume she's going to leave work when she has a child or take a lot of time off. But from what my results show, it changes people's time use patterns for years afterwards. So even after you've had a child, for example, women are more likely to use their paid sick days to care for a sick child than are men. And when you see the division of labor become less gendered in these households, beyond just the hiring decision, employers can reasonably expect sort of both gendered employees to, be as productive.
So, I think the issue here is really one of the level of generosity. So when we're talking about, some of the European countries, particularly I think some of the Nordic countries, you do seem to see effects. I don't think they're on hiring per se, but the positions people go into, that employers do seem to look and say if somebody's likely to take a lot of leave, they'll put them in a position where that's not as big of an issue. I don't think that's going to be a major concern in the U.S., at least at the present time, at least for parental leave, because, we're talking, I think realistically, we might be talking 12 weeks as an individual right, as a maximum for the foreseeable future. I don't think you're going to see major issues with that. If we were to do significantly longer leaves, or it could also be some of the family leave issues that could become more of a concern. My own view on policy here is you start out with something where you're fairly sure it's going to work well. And so I would view, in international terms, a very modest amount. If we're talking 12 weeks in international terms, that's modest. You get it in place, you run it for 5 or 10 years, see if you have issues, and then maybe you broaden it. But I think you need to be very cognizant of those kinds of concerns as you get to higher levels of leave.
Any other comments? Well, I mean, I would just add that, right now, 40% of American workers have no job-protected family leave, and we still suspect that women are discriminated against more for these reasons than men. So I'm not sure it's the generosity of leave that will contribute to employers treating the men and women differently. I agree that once you get up to a couple of years, the employers have another reason to do even more discrimination, but right now, there seems to be a baseline that's going on. And at least that's what most of the research suggests. Other comments? We're not compelled to stay until exactly 4:30. We want you to know that there's a reception that the Work Family Researchers Network is hosting. Jerry, can you tell us where that is? It's in the Capitol Visitor Center, isn't it?
Yes, the Capitol Visitor Center. Did we say 5 or 5:30?
I think it starts at 5, actually. We moved it up. It'll only take you 45 minutes to find the Capitol Visitor Center. Anybody know which room? Is that on here? I'm sorry, what was that? 201 on the house side of the Capitol Visitor Center. Okay. Flyers are outside. You can take them as you leave. Again, the conference starts tomorrow morning, Capitol Hilton, 16th and K, between K and L. If you're not registered, come on over. Thank you all very much.
It's not implying there's no discrimination presently. Just
I know, I just wanted, just in case anyone got that.